This is All India Radio. In the program Spotlight, now we bring you a discussion on Corona Kavach Health Insurance Policy and other initiatives. The participants are Puneet Jain, Senior Journalist, and AIR Correspondent V. Ravi Kumar.
Puneet, the coronavirus pandemic has brought the focus of societies and governments across the world on quality healthcare. Health insurance awareness is probably at an all-time high right now. Ironically, buying new health insurance has become difficult at the same time. So in this context, IRDAI has on 10th July 2020, that's yesterday, given its nod to 30 general and health insurance companies to launch short-term Corona Kavach Health insurance policies. So tell us a little about the Corona Kavach policy. What does it do and how would it help someone who is listening to this?
Last few months, concerns about health wellness have really become very paramount in everybody's agenda. And right now, if one wants to be sure about ability to meet expenses which incur, unfortunate incident like contraction of corona, then how does one deal with that financial stress? There were a lot of questions about whether existing insurance policies can deal with corona-related illnesses or not. So cover larger population, IRDAI has taken a very welcome step. They have introduced a very specific policy for treating corona cases in hospitals so that people who get infected, they don't have to deal with financial stress. For that purpose, IRDAI has come out with a standard policy. Why a standard policy? That means the policy wordings and the terms of the policy are same across all insurance companies. Change the policy depending on the company. They have to adhere to the conditions and the wordings that the IRDAI has mandated. So that is one very important aspect to know, that the policy terms are standardized by the insurance regulator. Now, this policy, interestingly, is designed only for COVID treatment. So anybody who takes a COVID Kavach policy, he will be covered only in case he contracts COVID infection and he is hospitalized. Therefore, the insurance premium in this case are also less compared to general insurance healthcare. If you take a general insurance, health insurance policy, then the premiums can be a few thousand rupees, for any family or for any individual. In case of Corona Kavach policy, the tenure is also smaller. Three options, 3.5 months, 6.5 months, and 9.5 months. And the premium is also significantly lower. So the premium, depending on the age, depending on the tenure that you're taking, the premium are very little, almost between a few thousand rupees to 4,000-5,000 rupees. That is the maximum policy premium that one has to pay. It's a policy which is designed specifically for the needs of treating unfortunate incidents like corona contraction by a policyholder. It takes into account all those features and concerns of the people.
So what you're saying is it's a very attractively priced short-term cover that's specifically for the COVID virus. Now, the question arises, common public will probably fall into two categories: the people who already have some sort of indemnity insurance or Mediclaim as it is called, and people who hitherto don't have this. Now, let's take them one by one. Let's say somebody who already has a medical insurance. Should he buy this? And if so, why should he buy this?
Typically, all medical insurance will cover your hospitalization expenses. So ideally speaking, general health insurance policy should be able to cover your hospitalization in case of corona. However, there are many insurance policies that fine print, we all have to go back and read in our policies. Many health insurance policies, they do not include pandemic diseases. So there is a possibility that the health insurance policy you have taken may not include a pandemic situation.
So the first thing is people should go back and check the fine print on their existing policy.
Exactly. And in case your pandemic disease is not excluded, then your already existing health policy will be sufficient. In case it excludes pandemic diseases, then there is a need for an additional policy, which may be Corona Kavach policy in this case. So that has to be taken additionally to the existing policy. Secondly, like I said earlier, general insurance policies are for a period of 1 year. They are renewable every year. But Corona Kavach policy is not a long-term policy. It is a short-term policy. You take it for 3, 6 or 9 months. It is not renewable in the sense that it doesn't get renewed after 1 year. So it takes into account the short-term concerns of people. In India, we have a situation where only 4% of the population has general health insurance policy. So I think right now when people are really worried about corona crisis, it is a very good idea to take Corona Kavach because it comes at a very low premium.
So what you're saying is that at the moment, the first thing that people who are listening to this probably should go back and check their existing policy and is a pandemic or an epidemic is covered or not. And if it is covered, there too, you're saying that it makes sense because it's at a low cost. Also, Puneet, if you see, if I do not claim on a policy that I have, I get something called a no-claim bonus, which can these days run into substantial lakhs. could be 1 lakh, 2 lakh, 3 lakh. And if I claim for, let's say, a small 50,000-60,000 hospitalization, I risk losing that no-claim bonus. So would it make sense for me to pay that minimum premium that you're saying is extra for Corona Kavach and cover myself and save my no-claim bonus on the main medical insurance policy?
These two policies are totally separate from each other. So your general health insurance policy and the no-claim bonus that you have gets paid or kicks in only when you renew it every year. And Corona Kavach policy has no renewal clause. So if you're taking policy now, let's say for the next 6.5 months or 9.5 months, then it doesn't have to be renewed. You will have to take a new policy. So there is no issue of no-claim bonus in this policy. It is a single premium. So you pay a premium only once. It remains effective only for the period for which you have taken the cover. And it doesn't cover any no-claim bonus issues really.
No, but if I already have a policy and I'm getting no-claim bonus on that, and if I have a Corona Kavach, I can save that if I use this.
That will continue as it is without any being impacted by the Corona Kavach policy.
Other thing that I see is that there are other consumables that normal medical insurance policies exclude, like PPE kits is now a big item that is added to most of the hospitalization expenses. So PPE kits or other things like oximeters and oxygen cylinders, many of these could get excluded by a normal medical insurance policies. Does the Corona Kavach policy include these, or are there any deductions allowed?
So Corona Kavach policy takes into account all issues which are related to corona disease. Interestingly, just to give you the main features of this policy covers your pre-hospitalization also expenses. So for 15 days before hospitalization, when you are at home and you may have incurred some expenses, those expenses also covered. After that, if a person has to be hospitalized, then the hospitalization expenses, this is on indemnity basis. So it is like a cashless insurance, but you don't have to pay the money. It will be, so it's an indemnity basis. And post-hospitalization, suppose you come back home, for 30 days also all expenses will also be covered. In addition to this, there is a provision for a top-up, or you take an additional cover where you can have a daily cash reimbursement from insurance company at the rate of 0.5% of the sum insured per day. So, and that is available for 15 days. So another, let's say 7.5% of sum insured will be given as cash back to the patient to cover the cash expenses during hospitalization. So I think it takes into account all these pre-hospitalization, post-hospitalization concerns, and also daily cash expenses. So it's been totally thought through, and most of the add-ons like PPEs and other expenses will also be covered under the expenses.
People who do not have any kind of medical insurance, indemnity insurance at the moment, and they are considering buying this Corona Kavach, and they like it because you're saying it's low cost. But the question they will ask is this enough? Do I need something more? And how should they go about looking at this?
Suggestion would be, ideally, people should go for a comprehensive health insurance policy which should cover all diseases, including pandemic disease. Now, that is something that we really have to ensure when we take a health insurance policy now. Earlier, we were not so mindful of it, but I think we need to be very careful in future. Secondly, even if you don't have a general health insurance policy because it may be expensive or whatever reason, I think people should, and particularly those who are exposed to the risk of contracting the virus, they should take the Corona Kavach at least, because this policy, the sum assured is between 50,000 rupees and goes right up to 5 lakh rupees. You can also take it individually. You can take it for your family on a floater basis. It will be a good idea for anybody who considers himself at risk of contracting coronavirus to take this policy. And like I said earlier, the premiums are not very high. They're quite reasonable. And the policy terms are standard. They're all approved by IRDAI. So it's a simple policy, not very complex. There are about 29 general insurance companies and health insurance companies which are offering this product. You can buy it online, you can buy it through your agent. Easy to buy, not very complicated, but I think it really serves the immediate need to concern of people who are concerned about the coronavirus.
And if you're buying it for 3.5 or for 9.5 months, you have to pay the premium at one go. It's a single premium policy.
It's a single premium policy, and also please remember the day that you buy the policy, there is a 15-day period during which it will not, let's say I buy it on 1st of the month. So for 15 days, the policy will not kick in. After that, for 3 months or 6 months, that is why I said 3.5 months or 6.5 month policy terms, because the first 15 days are not covered. Suppose somebody has corona today, he wants to go and buy the policy today to cover the expenses, that will not be possible. You buy it for 15 days, you will have to wait. It's called the waiting period. And after 15 days, the policy cover will kick in. So that has to be kept in mind.
Another question that people would commonly have is that pre-existing diseases, how does Corona Kavach treat people who already have, let's say, hypertension or diabetes or some other conditions, will that policy be issued to them? Will claims be paid to them in case they have pre-existing? Because normal policies have waiting periods for pre-existing diseases for up to 4 years. Whereas this is a 9.5-month policy or a 3.5-month policy. So how does pre-existing disease figure within the Corona Kavach ambit?
In case of Corona Kavach, if somebody contracts a coronavirus and is hospitalized, then and a comorbidity disease happens which is already pre-existing, or there is a comorbid disease, that will also be covered under the terms of Corona Kavach. So it does not preclude people with pre-existing conditions or comorbidity. So that is a very, I think, positive feature, that it covers all the pre-existing conditions for the period of the policy. And I think that is why they kept the policy to be very specific to coronavirus and for a very short period of time, 3, 6 months or 9 months. I think it's very designed to take into account all these concerns.
That should be music to the ears of a lot of people listening to this. Another question that comes is, since this covers only hospitalization due to coronavirus, there's sometimes a comorbidity or some other disease that could be triggered because of coronavirus. So will I be paid the claim for that?
It is triggered because the policy document very clearly says that if a comorbidity is triggered because of COVID-19 infection, then it will be covered. So it is not that a person who is, let's say, has a heart condition and he or she takes a corona policy and then gets admitted without a corona infection, they will not be covered. So only if you have a COVID-19 infection and after that you have a condition which is basically comorbid condition, then it will be covered. This 15-day waiting period, then you are sure that the patient, when he took the policy, is not corona positive and comorbidity happened after that. So that is the condition in this policy.
Recap on the boundary conditions, as in from what age to what age people can buy it, from what sum assured to what sum assured people can buy it. And you mentioned some optional extra benefit where cash is paid back. Recap that before we go further on the questions.
People between the age of 18 years to 65 years can take Corona Kavach policy. These are short-term policies. Basically, it has 3 possible terms. You can take it for either 3.5 months or 6.5 months or 9.5 months. It is a single premium policy. You pay the premium only once when you are taking it. It does not get renewed at the end of the term. You will have to take a fresh policy. The sum covered is between 50,000 rupees and up to 5 lakh rupees in multiples of 50,000. So you can take 50,000, 1 lakh, little bit more. These policies can be taken for individual or they can be taken for the family on a floater basis. That is the family, husband, wife, dependent children and parents-in-law. Parents-in-law are also covered under this policy. Take that. And another, also this policy will cover 15 days of pre-hospitalization expenses and 30 days of post-hospitalization expenses. Also, in case a person is treated at home, even there a 15-day period, person who is being treated at home, even 15 days expenses will be covered for the person. So it takes into account all those things. At the same time, another very important, I think, condition that they have kept is whenever you go to hospital, usually there are long delays in settlement, etc. In this policy, government has mandated that insurance companies will have to settle the claims within 2 hours of patient being discharged by the hospital.
Within 2 hours?
Within 2 hours. So let's say a person wants to discharge a patient after curing him, then the claim is filed, then the claim has to be cleared by the insurance companies within 2 hours. That is the insurance regulators mandate. So they have taken into account all those concerns, possible affected people.
Another question many people have these days is about alternative treatments. Ayush has become a very popular mode of treatment. People are moving towards other alternative forms of treatment. So is Ayush treatment also considered as valid for payment under the Corona Kavach?
This policy clearly states that Ayush treatment is also covered under the policy and all proved methods of treatment under Ayush are also covered by the policy expenses. So there's no hurdle on that front also, and people can choose whichever way they want to treat the virus.
Puneet, you have wonderfully brought out all the great benefits that this policy has. I'm sure anybody listening to right now would have one question. How do I sign up? Where do I go?
Online, all these policies are available. See, there are 29 general and health insurance companies in India.
And you're saying all of them are standardized, you can choose any one of them?
And all of them are standardized. They're all, however, the premiums may differ from company to company. The policy terms, the words of the policy are standard. They have been standardized and mandated by IRDAI. So the terms will be same, but premiums will differ from company to company a little bit. And they will also differ, of course, based on the age and the tenure of the insurance cover you're taking. So there are online insurance aggregators. They're called web insurance aggregators. You can go to any aggregator site. You can get all the policies. You can compare them.
Thank you.
Thank you so much, Ravi.
You were listening to a discussion on Corona Kavach Health Insurance Policy and other initiatives. The participants were Puneet Jain, Senior Journalist, and AIR Correspondent V. Ravi Kumar. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app News on AIR. This program is also available on our website newsonair.com. You may email your opinion about this program at airnsdtalks@gmail.com.